Dünyada heç bir sahənin işçiləri üçün Hipokrat andı kimi ant yoxdur. Heç bir sahədə ant yoxdur. Hipokratın andı qədim devrdən bizə qalan bu ant məhz səhiyyə işçiləri üçündür. Həkimlik peşəsini özünə seçənlər üçündür. Bu andı heç vaxt unutmaq lazım deyil.
Healthcare practice in Azerbaijan has long history. The existence of medical science in Azerbaijan dates back to the primitive communal system. This is proved by traces of trepanation on a human skull dating back to the 4th millennium BC, discovered in an archaeological site so-called Chalangan Tepe. It turns out that Azerbaijani doctors were then capable of performing such complicated surgical operations. Medical science was referred to as Muslim medicine in the Middle Ages due to its prevalence in the Islamic states. Of course, Azerbaijani doctors played an important role in the development of Muslim medicine. Jami al-Baghdadi, or Baghdad collection by medieval scholar Ibn Kabir, who lived in the 14th century, was used as the most recognized and well-known medical works in the Muslim world. In 1892, Azerbaijani scholar Abdul Khalik Akhundov launched an investigation into the history of medicine for the first time in our country. He translated a famous pharmaceutical encyclopedia written by Abu Mansur Haravi in the 11th century from Persian into German. The bulk of 400 medicine manuscripts kept in the Institute of Manuscripts of Azerbaijan National Academy of Sciences were once written by Azerbaijani doctors. 3 unique medical manuscripts kept by the Institute of Manuscripts were inscribed on UNESCO's memory of the World International Register with the support from Heydar Aliyev Foundation. The inscription of these collections on the world memory meant the inclusion of Azerbaijan into the countries with ancient heritage, and this is our victory. The practice of health reached a point of greatest development in Azerbaijan in the 19th and 20th centuries. After the establishment of Azerbaijan People's Republic, Khudatbey Rafibayev, who graduated from Kharkiv University, was appointed as the first Minister of Health. One of the most important steps then was to introduce free medical services in the country. New clinics and hospitals were opened in Baku, Ganja and other cities. After the collapse of Azerbaijan People's Republic in 1920, Azerbaijan SSR First Health Commissioners were Agha Kazımov and Mir Mövsim Qadirli. Kubra Farajova became People's Health Commissioner from 1938 to 1939, and then Azerbaijan's first female health minister from 1947 to 1950. It's an undeniable fact that the rapid development of medical science was spurred by the establishment of Baku State University and the opening of the Department of Medicine. Further contributions were made by scientific research and development institutes emerging in Azerbaijan after 1924. Azerbaijan Medical University was founded in 1930, and the first rector was Professor Aziz Aliyev. Then, Azerbaijan Institute of Doctor Qualification named after Aziz Aliyev was founded. As a well-known doctor and public figure, Aziz Aliyev made great contributions to the development of healthcare and human resources. In 1946, an experimental medical institute was established under Azerbaijan SSR Academy of Sciences. Over 45,000 terminologies on many medical subjects were published in Azerbaijani language through contributions by famous scientists. From 1920s to 1940s, hundreds of new polyclinics, drugstores and hospitals were established in Azerbaijan. A new stage of medicine started in Azerbaijan from 1970s to 1980s. Just a month after national leader Heydar Aliyev became the leader of Azerbaijan in August 1969, landmark decisions were adopted with a view to principally transform the healthcare and carry out sweeping reforms in the health and treatment sector. Those decisions brought great revival to the health sector. New hospitals, polyclinics and medical stations were constructed in town centers and rural areas. To meet the increasing demand for highly qualified human resources, Azərbaycan Medical University raised the student intake. At the same time, Central Clinic Urological Hospital, Neurosurgical Diagnosis, Burn Injury, Toxicology, Rehabilitation Centers, Chemical Pharmaceutical Factory, and modern medical facilities were opened. New buildings for scientific research and development ophthalmological institutes and scientific research and development oncological institutes were built. Besides, important decisions were taken to improve the medical services in Naftalan, İstisu, and Abşeron sanatoriums. A new generation of medical specialists returned to the country as highly qualified practitioners after studying abroad. Our country became an important health hub in the former Soviet Union by hosting the scientific and theoretical forums, congresses, and conferences. Academician Zarifa Aliyeva, spouse of the national leader Heydar Aliyev, daughter of the well-known public figure Aziz Aliyev, founded such an ophthalmological school that the foundation of this school couldn't be shaken even by the fall of the Soviet Union. Zarifa Aliyeva was the first scientist to research occupational eye disease by studying the harmful factors affecting the eye's entire and iodine production plants. Her research works on the eye virus diseases were also novelty in the medical science of Azerbaijan. The USSR Academy of Medical Sciences awarded her the prize, named after academician Auerbach, for the series of original works on the study and prevention of eye traumas in chemical industry. She was the first woman to get this award in the USSR. The health sector was also hit by the destructive trends after Heydar Aliyev resigned. June 15, 1993 went down in the history as the salvation day of the health sector as other ones. As a result, the development and improvement of health sector ascending from 1969 returned to track. That was a time when there were attempts to stifle our emerging independence. Armenians were invading our territories with the help of their supporters, and epidemics and insufficient sanitary arrangements were driving the country to the abyss. The war dealt the first blow to the health of people, led to the deaths of children and the spread of infectious diseases. Setting himself an important task of protecting the health of people, the national leader was thinking about how to put an end to the war, because that would be the only way to develop the state building, consolidate the statehood and independence, restore the territorial integrity, and prevent the infectious diseases. In May 1994, Armenia submissively agreed to a ceasefire with Azerbaijan due to Heydar Aliyev's logic. After the war ended, the attention was focused on sweeping reforms with the aim of recovery in all areas, including the health sector.
Her sahada olduğu kimi səhiyyədə də islahatlar həyata keçirilməlidir. Bu labüddür.
By order of Heydar Aliyev, extensive reforms were carried out in the health sector in order to improve the safeguarding of people's health. The modernization of logistics in the medical facilities, establishment of new hospitals, and extension of free medical services consequently paved the way for improving the quality of medical services for population. Coronary artery bypass surgery was performed in the country, facilitating the treatment of patients who were previously taken to Germany, Turkey, Iran, and other countries. National leader Heydar Aliyev signed an executive order in 1998 to establish an ad hoc committee for reforms in the health sector. Favorable environment for private clinics and hospitals further improved the quality of medical services. This trend was also encouraged by the enabling business environment in the country. Private medical centers appeared in Azerbaijan to enhance the competition in the healthcare sector. As a result, the health sector started to develop apace. Subsequent decisions gave impetus to the improvement of medical services. Heydar Aliyev, who paid great attention to the healthcare when he was in power from 1969 to 1987, brought revival to this sector again after he returned to power. Of course, this was not achieved so easily, because the health sector had been hit by prevalent dysentery, chaos, and anarchy from late 1980s to early 1990s. The most striking instance of this was the spread of infectious diseases which were more prevalent among children. The dangerous disease of polymyelitis was raging and paralyzing children. The national leader, who very much loved children and viewed them as the future of the mankind, prioritized the health care of children as a holy task. Azerbaijan then ranked among the first in Europe for the prevalence of child infectious diseases. At the initiative of Heydar Aliyev, the European Regional Bureau of the World Health Organization was also engaged in this endeavor. Various vaccines were brought to Azerbaijan and the raging infectious diseases were prevented. Azerbaijan joined the European Immunization Week on the World Health Day in 1995. National leader Heydar Aliyev presented a polymyelitis vaccine to a newborn baby, raising the immunoprophylaxis to the level of the government care. This tradition is successfully continued by President Ilham Aliyev. The head of state personally attended Azerbaijan's national immunization campaign on February 27, 2006. Mehriban Aliyeva, president of the Heydar Aliyev Foundation, also pays attention to these measures as priority of healthcare.
Adın nerede? Ay tamam, şimdi geçin. Kaç bir şey neydi? Vallahi diyeceğim, kızlar görürsün değil mi? Aferin. Yaxşıdır, yaxşıdır. Adımızı sən hədiyyə. Yaxşıdır.
A successful continuation of national leader Heydar Aliyev's political course, Ilham Aliyev's reforms also brought about remarkable development in the healthcare system as in other fields. The legal framework for healthcare was improved in our country with a short space of time. 50 new laws on healthcare were adopted. After approval of the state program for socio-economic development of regions, modern treatment diagnostic centers compliant with the international standards were constructed across the country. President Ilham Aliyev's personal participation in the groundbreaking and opening ceremonies for such health centers reaffirms the national healthcare and safeguarding of the health of people as the priority of our country.
Şübhəsiz ki, ilk növbədə insanları daha da narahat edən, daim maraq doğuran sosial sahəyə biz böyük diqqət göstərməliyik. Və Azərbaycanda indi sosial sahədə böyük işlər görülür. Yeni tip ocaqları tikilir. Rayonlarda Azərbaycanın müxtəlif bölgələrində yeni müasir müalicə diaqnostika mərkəzləri tikilir ki, insanlar yüksək tibbi xidmət ala bilsinlər.
As Azerbaijan's economic capability enhances, the quality of health services further improves. This sector is thriving as a result of President Ilham Aliyev's initiative, attention and care. An August 2006 presidential order for the privatization of several health, education, sports and culture enterprises and facilities also contributed to the development of healthcare. This order paved the way for the improvement of health services and provision of health centers with the state-of-the-art equipment. The establishment of the modern healthcare infrastructure is underway in Azerbaijan. New modern treatment diagnostic centers are being constructed in various regions of Azerbaijan. It's planned to build 12 centers in the regions at first stage. 2 of them have been commissioned in Lənkəran and Naxçıvan. It's also praiseworthy that unique cardiac operations are performed both in Lənkəran and in Naxçıvan. Every treatment diagnostic center is equipped with renal dialyzers and hemodialysis is available. The opening of modern treatment diagnostic centers in most regions across the country provides for the treatment of patients without going far away and without spending more to seek treatment. In accordance with the development program, 25 medical centers will be built in the districts of Baku. About 50 medical institutions have been constructed and renovated by the care of the state since 2007. These activities require huge amounts of funds and the government of Azerbaijan continuously increases funding. It shouldn't escape notice that the healthcare expenses increased by 5.4 times from 69 million manats to 371 million manats over the past 4 years and still increasing.
Dünyanın inkişaf etmiş ölkələrin təcrübəsinə nəzər salsaq, görərik ki, harda ki səhiyyə, böyük sərmayələr qoyulur, elmi tədqiqatlara böyük vəsaitlər ayrılır, o ölkələrdə də tibb sahəsi daha da inkişaf edir. Biz də bu gözəl təcrübədən istifadə etməliyik.
Under another presidential order, the entire ambulance service infrastructure shall be modernized in Azerbaijan, especially in Baku. 150 new modernly equipped ambulances have been imported to the country. New call response system will be deployed to improve the population's access to the first aid service. All ambulance services shall be provided with necessary supplies to further improve the emergency medical aid. Work is also underway to implement the state program for diabetes mellitus. There is remarkable progress in the supply of diabetes patients with medicines. Also, the state program has been launched for the provision of cancer patients with vital medicines against tumor. That is to say, no longer is it necessary for people to buy expensive medicines for months and even for years because they are now provided with medical preparations at the expense of the state. In our country, all registered hemophilic and thalassaemic patients are provided with plasma and erythrocyte volume free of charge. In children healthcare